This presentation will introduce you to the skill of treatment planning in marriage and family therapy. The ability to construct a treatment plan is an essential part of your practice as an MFT. Besides documenting your work with the client system, the treatment plan provides an opportunity to thoughtfully engage the system and track progress. In this brief presentation, I'll define the treatment plan and explain the purpose of it within the context of providing marriage and family therapy services. I'll also describe the components and format of the treatment plan and the role of assessment and case conceptualization. Patterson and colleagues explain the treatment plan defines the problems the system wishes to address and the interventions you will employ to address the problems. Your theoretical framework will guide your definition of the problem and the interventions you will select. For example, if you are approaching the system from a structural family therapy lens, you will likely define the problem as the family being stuck, both transactionally and developmentally. If you are approaching the system from an emotionally focused couples therapy perspective, you would consider the couple distressed. Bekvar and Bekvar describe how to perform a systemic analysis or a multidimensional assessment, which is crucial to constructing a treatment plan. As you gain more experience, you may have a general sense of how you will proceed with a new intake that appears on your schedule. However, you will be unable to create a nuanced plan without first conducting a thorough assessment. I will briefly describe the systemic analysis, but please refer to the Bekvar text for an in-depth explanation. In describing the client system, you will note who is part of the family and who presents to therapy. This includes noting the gender and age of all clients. What jobs do the parents have? What grades are the children in? If someone other than the parents is providing caregiving, what are the details of that arrangement? Are there chronic illnesses, addictions, abuse? Does anyone have limitations on physical ability? Is there anyone with neurodivergence? The family context entails the community in which they live and what support systems are in place. Is the family of origin close by? How involved are they? What are the friendship structures? It is important to understand the presenting problem from all members of the system, including the children. You'll want to assess how long the problem has been a problem and what solutions have worked. I recognize some MFT approaches may give less attention to what some theorists refer to as problem talk. But for the purposes of this global approach to treatment planning, it is important to have at least some sense of what the family wishes were different. On page 293 of the Bekvar text, the authors invite the therapist to describe the story you were telling yourself at each stage of assessment. This is also a time to wonder how your influence has impacted the assessment process. You'll next want to establish systemic goals and link those goals to specific interventions that are congruent with your theoretical approach. For example, if you are using solution-focused brief therapy, you would likely employ scaling and coping questions as part of your intervention strategy. You will describe how the interventions will move the family toward progress. Finally, you will implement the interventions and evaluate their effectiveness. The last two bullet points are not necessarily items you would find on an initial assessment plan, but you would certainly find them on a treatment plan that was updated mid-treatment. When constructing the treatment plan, recognize there is an emphasis on balance among various components to the plan. Of course, the plan should be relational and therapeutic. We are MFTs, and our conceptualization of the case should reflect our systemic approach to treatment. Above all, our plans should adhere to the AA-MFT Code of Ethics for our profession. We should also strive to interject our creativity and professional knowledge into the theoretical approach. Finally, we should frequently evaluate the treatment plan for its effectiveness and be prepared to adjust as needed. I previously mentioned the importance of approaching our work from a sound theoretical perspective. Patterson and colleagues explain, articulating a theoretical orientation helps us provide a professional rationale for our treatment decisions. In a practical way, a coherent orientation helps us build a bridge between the presenting problem, our assessment, and what we'll do with the client to create change. Our theory enables us to communicate in the language of the model and guides us as we prepare and provide treatment for the family. Patterson and colleagues go on to explain the idea of a case conceptualization. I think of the conceptualization as an opportunity during assessment whereby we begin to hypothesize about the distress in the family. They write, the conceptualization is a brief summary of the therapist's thinking or hypotheses about the presenting problem. In what part of the systems does the problem or problems exist? What explains the presence of a particular problem, and what is the relationship between the problems? Conceptualizing a case is not the act of providing a play-by-play of who said what in session. It is higher order thinking where we employ our knowledge of systems to the distress. Finally, Patterson and colleagues describe a good treatment plan. You can see the quote here on the slide. The last point is of particular interest because it helps us remember that while we are writing the treatment plan for our benefit, there are others who may see the plan, such as fellow clinicians with whom you are collaborating, attorneys, probation officers, judges, and of course, your supervisor. Finally, Suzanne Hanna provides a treatment plan format. You may be able to draw a few items from the intake forms, such as demographic information and how the clients articulate their perspective on the presenting problem. However, much of the information will be gathered orally during the intake session. It is common to include 3 to 5 measurable goals. The components of the plan are further explained on this slide. Again, some of this information may be gathered from the intake forms, but you will always want to review and verify those details. Here is a second slide containing the remaining elements of the treatment plan. During various courses, and certainly in internship, you will be asked to engage in treatment planning. Keep this video handy and feel free to discuss it with your faculty. I hope you find it useful.